10 signs that a cat is sick. When to sound the alarm. Cats are real masters at hiding their pain. Unlike humans and dogs, they won't complain about feeling ill, but simply try to behave as usual. However, there are a number of alarming symptoms that indicate health problems. If you notice at least one of these in your cat, don't delay in visiting the vet. Okay, here I go. 1. Loss of appetite or sudden increase in appetite. If a cat suddenly stops eating or, on the contrary, eats much more than usual, it may be a sign of serious illness. Refusal to eat can be related to gastrointestinal problems, kidney or liver disease, viral infections, stress, or even toothache. In some cases, decreased appetite may indicate poisoning or parasites. If a cat doesn't eat for more than a day, it's a red flag that needs attention. On the other hand, if the pet starts eating much more than usual, it may be due to metabolic disorders, diabetes, or hormonal failures. Constant hunger may accompany thyroid problems or gastrointestinal disorders. A sudden increase in appetite is also common in pregnant cats and in pets after sterilization, but if this behavior persists for a long time, it is better to consult a veterinarian. What to do? If the cat does not eat for more than a day, consult a veterinarian. Watch her drinking regimen, as lack of fluids can lead to dehydration. Check the gums. If they are pale or yellowish, this may indicate anemia or liver disease. If the pet has bad breath and refuses to eat, the problem is probably dental. In any case, if the appetite has changed dramatically and does not return to normal for several days, a specialist should be consulted. 2. Sluggishness and decreased activity. If the cat used to be playful, but now only sleeps and shows no interest in playing, this is a worrying sign. Sluggishness can be caused by a variety of reasons, ranging from banal fatigue to serious diseases. Often, decreased activity is associated with infectious diseases, anemia, heart abnormalities, or joint disease. The cat may be in pain, but may not show it clearly. Other associated signs are frequent breathing, weight loss, and changes in posture. For example, if the cat tries to move less, avoids jumping, walks slowly, something may be bothering it. You should also pay attention to body temperature. The normal range for cats is 38 to 39 degrees Celsius. An elevated temperature may indicate inflammatory processes, while a low temperature may indicate deterioration of the general condition of the body. What to do? Check the cat's temperature and observe its behavior. If lethargy is accompanied by refusal to eat, apathy, change in gait, or other symptoms, contact a veterinarian. It is important not to delay a visit if the pet's condition worsens or persists for more than a day. 3. Toilet problems, diarrhea, constipation, blood in urine, liquid stools, difficulty urinating, or blood in the urine are serious symptoms that indicate gastrointestinal, kidney, or bladder problems. Diarrhea can be caused by poor diet, a change in feed, viral infections, or parasites. If liquid stools continue for more than a day, there is a risk of dehydration, which is especially dangerous for young and older cats. Constipation is another common problem that can be related to lack of fluids, low fiber in the diet, or even intestinal obstruction. Constipation in cats is often accompanied by straining to defecate, a complaining meow, and an enlarged abdomen. Blood in the urine or difficulty urinating are warning signs that indicate urolithiasis or bladder inflammation, cystitis. A cat may go to the litter box frequently, but produce little or no urine. In such cases, delay is unacceptable, as untreated urolithiasis can lead to acute renal failure. What to do? If the cat has diarrhea, provide it with access to fresh water and temporarily transfer it to light food. If constipation occurs, you can add more fiber and water to the diet, but if the situation does not improve, urgently consult a doctor. If there is blood in the urine, frequent urination, or obvious discomfort when going to the litter box, contact your veterinarian immediately, as this may be a sign of serious illness. 4. Severe hair loss, balding, and combing. Molting is a natural process, but if there is excessive hair loss, balding, or scratching, there may be skin problems. This can be caused by allergies, fungal infections, parasites, e.g. fleas or ticks, hormonal disorders, or even autoimmune diseases. In addition, vitamin deficiencies, stress, and internal diseases can also affect the coat. If the cat licks and scratches frequently, the skin may become red, wounded, or crusty. Sometimes skin diseases can change the texture of the coat, making it dull, brittle, or greasy. In some cases, the cat may lick itself to the point of baldness in certain areas, which may indicate dermatitis or a behavioral problem. What to do? Examine the cat's skin carefully. Are there any redness, sores, parasites? If the pet scratches frequently and bald spots appear, see a veterinarian. Possible tests for fungal infections and parasites. It is also worth reviewing the diet. It is possible that the cat lacks useful substances. If hair loss is due to stress, try to find and eliminate the cause. 5. Behavior change, aggression, fear, hiding. Has your cat become aggressive, avoiding contact, hiding under furniture? This behavior may indicate severe stress or pain syndrome. Sudden changes in character can be associated with internal diseases, hormonal changes, injuries, or even deterioration of vision and hearing. If the cat is in pain, it may avoid touch, hiss, or even bite when you try to pick it up. A sudden change in habits is also a red flag. For example, if the cat has always slept next to you, but now spends time in secluded areas. This behavior can be caused by anxiety, fear, or poor health. What to do? Notice if something has changed in your cat's environment. Is there a new person, animal, or object that may be scaring her? If the cat hides for a long time, behaves aggressively for no apparent reason, or refuses to eat and socialize, urgently to the veterinarian. The vet will help you determine if it is due to illness or stress and will tell you how to help your cat. 6. Shortness of breath, coughing, wheezing. Shortness of breath, frequent coughing, or breathing with the mouth open is a serious cause for concern. These symptoms can indicate a number of conditions, including asthma, respiratory tract infections, such as pneumonia or bronchitis, pulmonary edema, often associated with heart failure, a foreign body in the airway, or even the presence of a tumor in the chest. Shortness of breath is characterized not only by the cat breathing heavily, but also by the fact that it may extend its neck, open its mouth wide, use its abdominal muscles to breathe, and its nostrils may dilate. Breathing may be shallow and frequent, or conversely, infrequent and deep with visible effort. Assess her resting respiratory rate. Normal is 16 to 40 breaths per minute. What to do? If the cat breathes through the mouth, especially if it is accompanied by lividity of the tongue or gums, immediately to the veterinary clinic. This is a critical situation that requires immediate help. While you're on your way to the vet, try to keep the cat as calm as possible, avoid stress, and don't touch it unnecessarily. Check the humidity in the room. Air that is too dry, especially during the heating season, can irritate the airways and aggravate your pet's condition. Use a humidifier or place containers of water near radiators. Avoid smoking in the room where the cat is, as tobacco smoke is also a strong irritant to the respiratory system. 7. Mucus discharge from the eyes, nose, mouth open while sleeping. If the cat's eyes start watering, has purulent or copious clear nasal discharge, or breathes with its mouth open even while sleeping, it may be a sign of an upper respiratory infection, such as calicivirosis or herpes virosis, an allergic reaction, a foreign body in the nose, or dental problems. Pay attention to the consistency and color of the discharge. Clear discharge is more likely to be associated with allergies or an early-stage viral infection, while purulent discharge is more likely to be associated with a bacterial infection. Breathing with the mouth open while sleeping indicates a serious breathing problem, as cats tend to breathe through their nose. If the cat is wheezing or panting while doing this, it requires immediate veterinary attention. What to do? If the discharge is purulent, yellow, green, thick, go to the veterinarian immediately. Bacterial infections require treatment with antibiotics. While you are waiting for a doctor's appointment, you can gently flush the eyes and nose with saline solution or specialized/nose lotions designed for cats. Rinse the eyes several times a day, gently removing secretions with a clean gauze cloth. Make sure the cat is comfortable and does not resist the procedure. Do not use cotton swabs inside the nose, as this can damage the mucous membrane. Make sure the cat is eating and drinking well, as appetite may decrease with infections. 8. Rapid weight loss or gain. If a cat has begun to lose weight rapidly but is eating normally or more, this is a warning sign that may indicate diabetes, especially in cats over 7 years of age, hyperthyroidism, increased thyroid function, cancer, e.g. lymphoma, liver problems, e.g. hepatic lipidosis, kidney disease, chronic renal failure, or parasitic infections. Abrupt weight gain, especially if it is rapid, may indicate fluid retention, edema, which may be associated with heart failure or kidney disease. Assess the cat's fatness using the BCS, body condition score. Weight loss may be manifested by loss of muscle mass, especially along the spine and on the hind legs. What to do? Monitor your pet's weight regularly, e.g., weekly or biweekly. Use a home scale, such as a floor scale or veterinary scale, if available, for accurate measurements. If changes are noticeable for no apparent reason, change in diet, increased exercise, etc., veterinary consultation is necessary. Be sure to inform the veterinarian about changes in the cat's appetite, drinking, activity, and behavior. The veterinarian will perform the necessary examinations, blood tests, urine tests, ultrasound, to determine the cause of weight changes. 9. Bad breath. If the cat has a strong and persistent bad breath odor, rotten, ammoniacal, or sweetish, it may indicate kidney disease. Ammoniacal odor indicates uremia and renal failure. Liver, sweet or putrid odor. Diabetes mellitus, sweet, acetone-like odor. Dental problems, gingivitis, periodontitis, tooth decay, or digestive problems, food retention in the esophagus, stomach problems. Pay attention to the condition of your cat's teeth and gums. Inflamed, bleeding gums, tartar, and wobbly teeth can be the cause of bad odor. What to do? If the odor is pungent and unusual, persists for a long time, and does not go away after brushing, if you brush, get your cat to a veterinarian right away. The vet will perform an oral examination, take dental x-rays if necessary, and order blood tests to determine the cause of the odor. Brushing your cat's teeth regularly, with a special toothpaste and pet brush, can help prevent tartar and gum disease. If the cat does not allow brushing, you can use special gels or oral liquids that have antiseptic and anti-inflammatory properties. 10. Vomiting, especially frequent, bloody, or foamy vomiting. Occasional vomiting in cats is not always a concern, as cats often regurgitate their fur, but if it becomes frequent, several times a day or for several days in a row, accompanied by blood, red or black clots or streaks, foam, white or yellow, bile, yellow liquid, or the cat is depressed and refuses to eat, it is cause for alarm. Vomiting can be caused by poisoning, a foreign body in the stomach or intestines, infection, viral or bacterial, inflammatory bowel disease, IBD, pancreatitis, liver or kidney disease, parasites, or even tumors. What to do? Stop feeding the cat for 6 to 8 hours, but provide access to fresh water in small portions to avoid dehydration and repeated vomiting. If the cat drinks too much water at once and vomits, remove the water for a while and offer it in small portions every 30 to 60 minutes. If the vomiting does not stop, the cat's condition worsens, lethargy, refusal to eat, abdominal pain, or there is blood in the vomit. Urgently see a doctor. The veterinarian can prescribe antiemetics, infusion therapy, drips, to replenish fluids and electrolytes, as well as conduct the necessary examinations, blood tests, x-rays, ultrasound, to identify the cause of vomiting. Do not give your cat any medications without a veterinarian's prescription. Cats are known to stoically tolerate discomfort and rarely give obvious signals about their ill health, so it is extremely important to be attentive to any changes in their behavior, appetite, appearance, and habits. Inspect your cat regularly, paying attention to their activity, coat, teeth, and gums. If you notice one or more of these signs, don't delay a visit to the vet. The earlier a problem is detected, the easier and more successful it can be treated. Regular preventive examinations at the veterinarian, once or twice a year, will help to detect diseases at an early stage and prevent their development. If you found this article useful, please share it with other cat lovers. Tell your friends and acquaintances who keep cats about it. Your pet will be grateful for your care and attention.